Peace and welcome back to another episode of Monday Musings with me, your girl Nicole, sister midwife, where I share what's on my mind about finding joy, building my Black business, and raising my free Black girl in this crazy ass world. So right now I am super excited. I am putting the final preparation and touches on my trip to Fort Lauderdale to MC the Broward County Healthy Start Coalition's Maternal Health Conference. So this is my second year going to be with them in Fort Lauderdale, and I am super excited. I'm also super busy. And so today's Monday Musing is going to be short. I'll share a few words and some thoughts about Black Maternal Health Week. I'm going to share some information about how you can get a free Birth is the Revolution t-shirt, or maybe you can get some stuff in the giveaway from Wish Garden Herbs. It's connected to a directory promotion that we're going to have during Black Maternal Health Week. So stick around, listen to the entire video so you can get that information as well. Now, if you're a Black birth worker, you likely already know that Black Maternal Health Week gets started on Friday, April 11th and runs through April 17th. This year's theme for Black Maternal Health Week is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. Some of you may not know, because it's a little more newer, Friday, April 11th, in addition to being the first day of Black Maternal Health Week, it is also Black Doula Day. Their theme for Black Doula Day is The Future of Birth Work is Ancestral, Reclaiming Black Birth and Postpartum Wisdom for Birth Justice. So that means that there's going to be a lot of stuff going on in the next couple of weeks around Black maternal health. And some of you may be wondering, where are the events near me? And I know that some of y'all are, because I'm getting DMs, I've gotten emails, I've gotten tagged. The easiest thing to do, y'all, to find out where events are around you is just search the internet, use the hashtags, use your city, and search Eventbrite. Searching Eventbrite can bring up a lot of different events. Some of y'all may feel inspired. You don't see anything happen in your community, or maybe you see one thing happening in your community and you're like, you know what, I want to do something as well. Maybe you can't do anything this year. That is okay. Trust and believe. Black Maternal Health Week is every week as far as I'm concerned. Black Doula Day is every day as far as I'm concerned. So there is time, and these weeks and days will repeat again next year because they're annual things, right? So if you are inspired and you feel like you want to give back into the community doing an event, you want to connect with other birth workers, by all means do that. Find out who in your community is already doing something. Also find out who maybe they're not doing anything, but they want to do something, but they've been looking for you to connect with, to partner with them to make it come to fruition. So this is a great time for networking. It's a great time to build awareness for yourself. It's a great time to just become informed about all of the different things happening, not only in your local community, but also on a national and even international level. That said, as we move through Black Maternal Health Week, some of you may begin to feel overwhelmed, because if you follow a lot of birth workers, it is going to be nonstop on your timeline. It's going to be trending in your space, and you begin to feel overwhelmed. There is nothing wrong, sis, with tapping out just a little bit, especially if a lot of what you're seeing is about maternal mortality and death and dying, and there's less of the joy. We have definitely turned the corner. I was very concerned when we first started having Black Maternal Health Week, and it was all this just, Black mamas 4 times more to die, over and over and over, and that was all that we were seeing out there. And I took a pause button on that immediately, and I was like, if we are calling this Black Maternal Health Week, then let's talk about not only how to be healthy, but how to stay healthy and how to birth healthy. Now we see a lot more of that. We see a lot more balance, but that doesn't mean that you still can't get tapped out of the conversation, or you can't get, you can still get overwhelmed and just feel like it's so much coming at you from every direction. And so if you're beginning to feel that way, do not hesitate to tap out to take care of yourself. Now, no matter what you're feeling as the week progresses, remember always that every week is Black Maternal Health Week, and every day is Black Doula Day. Don't wait for these times. Don't depend on these times. And if you missed the boat this year, remember that there's always going to be next year. Now, speaking of missing the boat, I had intentions during World Doula Week to do a big directory promotional giveaway, and it did not happen. I missed the boat for World Doula Week, and that's what I'm saying. Sometimes we have to give ourselves grace. These days will come, these weeks will, there. It's beautiful. We have these different days and designations to raise awareness about different things and to, increase the national dialogue about the things that we're talking about every single day. That said, you might miss the boat. It is not the end of the world if you miss Black Maternal Health Week events this time. There are different events happening virtually, and there will also be events happening after Black Maternal Health Week. Some people choose to use the week as like a springboard for something that's going to happen 2 weeks or a month later. So just pay attention and stay plugged in, right? So back to me. I had intentions for World Doula Week of doing a promotional giveaway with the directory. Did not happen. So now, we're going to have the promotion. And the promotion is starting today as you hear my voice, and it's running all the way through the end of Black Maternal Health Week. First part of the promotion, if you get listed on either directory, blackdouladirectory.com or systemmidwifedirectory.com. If you get listed on either directory, a new listing, y'all, if you are not listed, and you are newly listed from now until the end of Black Maternal Health Week, you will be entered into a drawing to receive a free Birth is the Revolution t-shirt and to also receive some products from Wish Garden Herbs. Wish Garden Herbs has partnered with us and sent us a beautiful box of products: pregnant belly oil, happy ducks, free the flow, it says, morning sickness, nausea relief. This is a baby balm. This is a new mother's nursing balm. And we have enough products to create a number of gift bags or gift sets that we were going to be shipping out. So if you join the directory at blackdouladirectory.com or at systemmidwifedirectory.com and you are a new listing, you will be entered into the drawing to receive this promotional bundle. Now, listen to me good, y'all. If you are a doula, you must go to blackdouladirectory.com. That is the doula directory. That's where doulas are listed. That is where people are coming to find you. On systemmidwifedirectory.com, this promotion is for midwives. If you are a Black midwife, and you go to the directory and list yourself, systemmidwifedirectory.com, you will be entered into a drawing to get the t-shirt and the products from Wish Garden Herbs. We're going to do more than one. We'll do somewhere, at least 2 per directory, so there is space for a lot of people. Definitely go ahead and get yourself listed so that you can get entered into this drawing. Now, if you upgrade to premium, on either directory, whether you are a new member or an existing member, if you are upgrading to premium for the first time, you will automatically receive a code for a free t-shirt that will ship directly to you, and you will receive a second entry into our Wish Garden Herb t-shirt giveaway. So if you upgrade to premium, you're going to get extra goodies. Remember to make sure that you are getting listed on the proper directory. We have some doulas who are going to the Sister Midwife directory and listing themselves in the category that is not for doulas. If you are a doula, make sure you visit blackdouladirectory.com. blackdouladirectory.com. If you are a doula, if you are a midwife, go ahead and get yourself listed, systemmidwifedirectory.com. Now, that said, y'all, if you did not know, you might already know. The government cuts have hit the maternal child health community pretty hard last week. And I don't know all of the details, okay? But I did hear about these major cuts at the CDC. And so what I'm going to do is I'm going to read some stuff in case you don't know about it. I'm going to read some stuff from the HuffPost that they put out on Friday. Okay, so their article said the majority of the CDC's Division of Reproductive Health was laid off on Tuesday. This was last Tuesday, almost a week ago tomorrow. A handful of impacted workers told HuffPost. The team was made up of around 100 highly specialized researchers and scientists, many of whom had worked at the CDC for decades. The Reproductive Health Division was made up of 3 main branches: the Maternal and Infant Health Branch, the Women's Health and Fertility Branch, and the Field Support Branch. The administration, the Trump administration, dismantled the latter two. So that means the women's health and fertility branch was nixed and the field support branch was nixed. I'm going to keep reading through from the article. Without them, national data on reproductive health care will quickly become outdated and useless, creating a domino effect of baseless lawmaking that the former officials said will risk the health and lives of millions of American women, pregnant people, and children. The now defunct branches were responsible for monitoring IVF cycles nationally and conducting research that made the fertility treatment safer and more successful. One thing that they talked about in the article was, like, as an example, the people who were over this area, they were instrumental in creating the laws that now there's only single embryo transfers versus those large number of embryos that used to be transferred, right? The article says one of the teams that has been eliminated published contraceptive guidelines that any U.S. physician speaking to patients about birth control options has used for the past 15 years, and probably midwives as well were using some of this same documentation. The team was also responsible for the annual abortion surveillance report, which reflects the number of abortions performed in the United States, and is commonly used by lawmakers and health experts. They also talked about there were emergency response plans that these individuals helped create that were included in guidelines for pregnant people and newborns, such as what to do with the woman with gestational hypertension during a hurricane and how to feed a newborn formula without potable water. The team that tracked IVF, they got nixed. IVF is a multi-billion-dollar industry. We know this. And so, like somebody said in the article, quote, where there is profit, there's a need for transparency and independent data. The field service branch worked on the ground in states and other jurisdictions as a kind of a canary in the coal mine, the article says, so that former reproductive, those leaders could have a small team of epidemiologists who were essentially frontline workers. So these people have been nixed, okay? Things are hitting us all at home. But I want you to seriously consider, number one, as we enter Black Maternal Health Week, I want you to really think about the word from the themes: collective action and advocacy. When we move towards Black Doula Day, I want you to really think about the theme, reclaiming Black birth and postpartum wisdom. And I gotta tell you that I have always believed, and I still believe today, that it is our job to take care of us. Ain't nobody running into the burning building to save your children but you, to save your mama but you. So all of these children, the Black babies, the Black mamas, they are my children, my sisters, my families, my mamas. So it is up to us as Black birth workers to continue to plug away at the issues collectively. It's so interesting to me, this new article, and I know some people are going to be up in arms and frustrated about all of the things, and rightfully so. Be up in arms and be frustrated and keep the fight going. You know what I'm saying? But I want to point out that, number one, the statistics are not new. And even with all of the surveillance and numbers and things that they were doing, nothing wasn't really changing too heavily. Yes, as grassroots organizations, CBOs, the money was beginning to trickle down in some ways. But I want you to understand that historically, we are really just kind of taking a step back. I'm not saying that that's not a problem. It's a problem. What I'm saying is we've been here. And we know how to support each other and to fix our problems if we move collectively. I'm even thinking about this document around breastfeeding or bottle feeding rather in disasters and taking care of women with gestational diabetes and hurricanes, that little piece of the article. We have an organization and individuals right here in New Orleans who created a whole emergency preparedness kit. They created that because we knew that our community needed this extra information. So Birthmark created in the New Orleans Breastfeeding Center, they created the documents. We have these things. We have the knowledge. We have the information. We can take care of ourselves. And quite honestly, y'all, whether we could or could not, right now, we do not have a choice. We do not have a choice. Now more than ever, it is essential for us to band together to work collectively. I have always believed that we have to take care of ourselves. I have always believed that we need to make sure that this information is shared with our sisters. The information is sacred, but it should not be secret. I have always said that we must embrace Ubuntu, Umoja. We must remember the proverb that says to go far, we must go together. If y'all saw Mufasa, they was singing. If you wasn't familiar, we knew that proverb before the movie, okay? But if you saw the movie, they sang it. You want to go fast, go alone. You want to go far, go together. There is a far way we got to go in this work. So we don't have time for divisiveness. I do not have all the answers, but I know division is not the way. I do not have all the answers, but I know complication is not the way. Bells and whistles are not the answer. Simplification and unification are the way to our elevation. It's a heavy, baby. Let me tell y'all something. I got a grant right now that might just go out the window because of these cuts and because of these firings, and who knows. So we're all being impacted, and I know my work was going to be good, but it's the reality that we're living in, and so we must stand together. All right, y'all. That's all I got. As always, take what you like, leave the rest. If something in this episode resonated with you, please do leave a comment, like, and subscribe. Go tell another person, and make sure you catch me back for another episode on another Monday. Until then, keep serving, growing, and showing up. Don't forget to fill your cup, and don't forget to tell the world that birth is the revolution. Peace.